this presentation on behalf of our Chief Clinical Officer, Christine Pendy. So I'm going to be adding my own little flavor to it and some of my experience as well. Just a little bit of self-disclosure about me. I have been working at the hospital since 2016. I started here as an intern and I began my career here as a staff clinician in our acute partial program. So throughout COVID, I've been here. I did not get any work from home options. I have been in the hospital, powering through, experiencing being an essential employee. So, kind of experiencing this on somewhat of the front lines has been its own challenge, and it has impacted, my mental health, as I'm sure everyone's mental health. So I'm hoping that, we can all identify with each other as I share this experience with you, as well as this information. So we're just going to start off brief COVID statistics. These are the most updated statistics. Chris actually prepared these for me. So in the United States, we've currently had 43.7 million cases. Of those, we've had 701,000 deaths. So we do see that this is now, I believe the recent numbers have said that we have surpassed the Spanish flu as the worst epidemic in our country. In New Jersey, there's been 1.16 million cases and 27,472 deaths. We all know that we've been affected a little bit differently in New Jersey. We saw how New York was impacted. And of course, many of our Jersey residents are New York employees. So we see how the interaction between these two states have contributed to these large numbers that we're experiencing on the East Coast. A little closer to home, Bergen County, 117,000 cases, and of those 2,962 deaths. So very, very sad to recognize, very, jarring numbers to look at. On a global scale, there's over 3.3 new cases every minute, I believe. Over 55,000 new deaths reported between the 20th and 26th of last month. Some silver lining, perhaps we can call this. There's a 10% decrease from the prior week. So any kind of decrease is positive. I know we're dealing with the various variants. So a cumulative number of cases of 231 million cases and 4.7 million cases globally. So we are seeing, the impacts of COVID still almost 2 years later. So the variants of concern that we are probably hearing about a lot in the news: Alpha, Beta, Gamma, and Delta. Delta seems to be the most popular one here in the US. I believe it originally came from the UK. So we are experiencing the Delta variant at a higher rate. So kind of getting into the meat of this presentation, grief. Grief can be a lot of things, grief and loss. Grief is not just something we experience because of death. Grief can be something we experience because loss of a job, loss of a home, loss of normalcy, which I think is probably the biggest thing that we're all grieving right now, is our normalcy. When we could go to stores without masks, when we could go to family gatherings without fear of getting sick. And, when our concerns of, being within 6 feet of each other were pretty slim. So many people are experiencing grief during the COVID-19 pandemic, and grief is a normal response to loss during or after a disaster or other traumatic event. And we would consider, I would say, as a mental health professional, the experience of COVID-19 is traumatic for many people. Grief can happen in response to the loss of life, as well as any drastic changes in our daily routines or ways of life that usually bring us comfort and a feeling of stability. So David Kessler, who is an expert on grief and loss, he came out with the stages of COVID grief, which I thought were pretty poignant, especially in our presentation. So very similar to the Kubler-Ross stages of grief. This is how we experience grief in COVID. So denial, which we saw pretty early on, this variant won't affect us. I mean, I myself looked at this with disbelief. We hear about a virus going on the other side of the world. We think, oh, well, that can't hurt us, can it? And, unfortunately, it did make its way across the globe. Anger, you're making me stay home and taking away my activities. I'm mad because I don't get to do the things I want to do. I'm mad because I'm being told to stay home when I want to go see my family and I want to have my life normal the way I'm used to it. Bargaining. Okay, if I social distance for 2 weeks, everything will be better, right? Okay, I'm going to play by the rules. If I do this, they said it's only, remember March 2020? 2 weeks, guys, just 2 weeks, and we're going to stop the spread. Okay, I'll stay home for 2 weeks. Sadness. I don't know when this is going to end. I think we experience this on a day-to-day. when is this going to end? How long is this going to be going on? We get new information every day that just kind of throws off our equilibrium. So that sadness, that grief, when is this going to end? When am I going to get my life back? Acceptance. This is happening. I need to figure out how to proceed. So when we start to kind of accept, like, I don't want to say the new normal, or just like accepting the world with COVID might be a better way of saying it. Accepting that this is the way the world is working right now. This is the way we're functioning. And unfortunately, it doesn't look like what we're used to, but I have to accept this and I have to, do my part. And that can be kind of hard. Acceptance isn't saying I agree. Acceptance is saying I accept what it is. And, to put it as blatantly as possible, it is what it is. I don't agree with it. I don't have to agree with it, say yes or say no. I just have to accept that it is. So grief is a strong, sometimes overwhelming emotion for people, regardless of whether their sadness stems from loss of a loved one or a terminal diagnosis or someone they love or someone receiving a terminal diagnosis. We experience an emotional response. Those experiencing grief might find themselves feeling numb and removed from daily life, unable to carry on with regular duties while saddled with their sense of loss. So sometimes we do detach emotionally, maybe we become a little bit emotionally numb, and that is a trauma response. Sometimes we need to kind of disconnect from ourselves because that's how our brain is going to protect itself from this really deep, difficult emotion. Grief is a natural reaction to loss. Grief is both universal and a personal experience. Individual experiences of grief may vary and are influenced by the nature of the loss. So some examples of loss, like I said earlier, might be the death of a loved one, the ending of a relationship, job loss, loss through theft or loss of independence and through disability. So loss encompasses a lot of things, and we can kind of consider the loss of our ability to, socialize the way that we'd like to, or to, go to the grocery store or just run our lives day to day. That's a loss, and it's a tremendous loss. So something that might also come up in this age of COVID is anticipatory grief. And anticipatory grief is the fear of what comes next. And we're probably going to experience that naturally because every day as we turn on the news, we hear about new variants, new symptoms, new exposures. That anticipation of, oh gosh, what's going to come next is going to trigger some anxiety. So experts advise those grieving to realize that they can't control the process and to prepare for the varying stages of grief. Understand why their suffering can help, as can talking to others and trying to resolve issues that cause significant emotional pain, such as feeling guilty for a loved one's death. In experiencing, in talking with clients and patients in this setting, some of which have lost loved ones due to COVID, there is a feeling of guilt, this guilt that could I have done more? I unfortunately, due to the nature of the virus, some people cannot see their loved ones at the end of their life. So the guilt of I wasn't there, it's a very complicated feeling because although we want to be there, we can't because physically we're not allowed to for our own safety. And that guilt of I put my own safety and my own health prior to theirs. So it can get pretty complicated. So mourning can last for months or years. Generally, pain is tempered as time passes, and those who are grieving adapt to life without the loved one or the news of a terminal diagnosis or the realization that someone they love may die. So, there is no timeline. Everyone's timeline with grieving is their own. It is completely personal. And we're going to talk more about when that timeline might be a little bit unhealthy or become unhealthy, but grieving is a completely and very personal situation. How we grieve is all about how we manage our emotions. So continued disruptions and losses can be triggering, can be a triggering event that leads to constant recycling of the grief process. Because of this, the cumulative grief cycle could be very damaging to one's psyche. So when we think about COVID specifically, when we get new information, when we hear about, someone else getting sick or someone else dying, and we've already experienced that loss, it's kind of like adding on to our grieving process. It doesn't mean that we start at square one, but it does kind of add another layer to that process, to our grieving experience. So managing grief in a healthy way. So one of the most difficult parts of living life and losing someone we love is grieving in a healthy way. And you're probably thinking like, well, how do I grieve something that's so terrible? The pain and grief can feel like an ever-present weight that pervades at every moment, but learning how to manage grief in a healthy way can sometimes be challenging. Everyone processes loss and grief differently, but healing occurs at different rates. Again, it's a super personal experience. Some people feel that certain forms of grieving are disrespectful to those who have lost. So something I hear quite often is that when someone starts, their grieving process and they're moving through their grieving process and they start to feel a little more quote unquote normal, or they feel as though they're back to themselves somewhat, there's that guilt, like, how dare I feel this way when my loved one is not here? Or how dare I feel this way when there is so much going on in the world? It's this guilt, like I shouldn't be feeling this way because there's so much pain. Despite this, the most important of handling grief is realizing there is no one way to correctly do it. Everyone is going to grieve differently. Their process is going to be different. The steps, the stages will be different. So it's incredibly personal. So what grief brings? So grief can bring the raw, intense emotions that for some people might seem impossible to handle. Others may not even realize they're grieving. Loneliness is common, as is withdrawing from social situations and other people. This might be a little more heightened too when we think about COVID or social distancing. We're not even, although we could withdraw from social situations, we don't really have that many options to be in social situations. So we kind of experience loneliness just because of trying to keep everyone safe and, dealing with our grief and being alone in that, but then also being not forced, but, needing to be alone. So guilt frequently accompanies grief, and it's one of the hardest feelings to bear. So some people may feel anger targeted at whomever they hold responsible. So we did see this in COVID. We did see that, people got angry at doctors or nurses. They got mad at the CDC, like, what are you doing to my life? How dare you enforce these rules? We did see a lot of people get very upset when we have these shelter in place orders. They can be, so when we talk about, dealing with the grief of a loss of life, people can be themselves with the deceased, a friend or family member, or another target. So this might be misplaced anger. So they might be angry at somebody who passed. They might be angry at, somebody who has nothing to do with the situation because they just need to put that feeling somewhere. And again, with that, we do get somatic. Symptoms. Some people may experience loss of appetite, a feeling of apathy, sadness. Some people might have, body aches. They might feel fatigued. They may feel weak. Their stamina might not be the same. So we do see that grief affects us physically. So how do we start? What's the process start as? So one of the first things we do when feeling grief is recognize that it is normal. Almost everyone experiences grief following a loss. Different cultures and society grieve differently, but nobody should ever feel pressured to grieve in a manner that isn't comfortable. If a person needs to grieve loudly and openly, that's normal. And on the other hand, some people like to grieve internally, and that's okay. For some people, grieving might be a very personal experience in which they want to be alone. They want to process their own thoughts and feelings on the situation. Maybe it means journaling. Maybe it means, continuing the relationship with their loved one that has been lost in their own way. And it isn't a matter of learning which emotions to suppress or subdue, but rather allowing grief to come and go naturally. So I always like to describe grief, feelings in general, but grief too. Grief and feelings are waves. Imagine being on a beach and you see the waves come and they go, and we see them coming, and eventually as they come, they go. So the feeling is going to come, and it might feel like the feeling is so overwhelming that it is forever, but it's not. Feelings aren't facts, they're information. So as this feeling comes, it will go. How long it stays varies, but eventually the feeling will pass. But there is sometimes pressure to grieve in a certain way, and that can prevent people from ever properly learning to live with the loss. So something we hear quite often, I'm sure maybe everyone has heard this, when a loved one, especially if they were sick with COVID, unfortunately dies, someone might say, well, at least they're not suffering anymore. Well, that doesn't really help. I know it's coming from a place of caring, but it puts pressure on the person to say like, you shouldn't be feeling this way, or like your feeling isn't valid. You know, when people put pressure on us to not feel the way we feel, it just causes it might cause the feeling to intensify. So expressing grief and mourning. So grief is unavoidable, and trying to repress it or ignore it can lead to feeling worse. Many outside influences affect the way we feel or we should grieve. So we're going to have family, friends who are telling us how they think we should grieve, how they think we should manage it. But again, it's how we choose to deal with it. So allowing ourselves to mourn openly and outwardly without feeling restrained or restricted can release many of the emotions we bottle up inside. So think about when you shake up a can of soda. Like you shake it, and then all of a sudden when you open it, it explodes. That's kind of what happens when we push down these feelings. When we just suppress these feelings and we push them down and we don't express them, eventually we're going to explode. It's going to come out some way. And normally when we suppress these feelings for a very long time, they come out in unhealthy ways. And that might be, unhealthy, like yelling at people or misdirected anger, or maybe it's, being aggressive. It could come out in really unhealthy ways. So as these feelings come, we need to let them out as they come and go, because that's the healthiest way to kind of express them. And some people may cry, some may yell, some people may laugh. Whatever form mourning appears in, it's an integral part of reducing the intensity of the grief and expressing ourselves. So there is no wrong or right way to grieve, but there's also no wrong or right emotions in grief. Finding support. So after a loss, many people begin to withdraw from others, especially individuals they associate with their grief. However, one of the best methods of learning to live with loss can be confiding in other loved ones. They provide a support structure that can help us. I know in the age of COVID, it's kind of hard because when we are grieving a loss, maybe sometimes we want that physical contact. We want a hug from someone we love. We want to be near somebody that we love. We want to express how we're feeling in person as opposed to a Zoom call or a FaceTime or a phone call. But, we kind of have to adjust our sails and kind of adjust to how we grieve. And we might need to adjust the way that we can connect with others. And maybe the grieving will have to happen over a FaceTime call. Maybe it has to happen 6 feet apart outside. It's not going to look maybe the way we'd like, but we do need to find support and express ourselves. So even people who have never experienced loss can act as an anchor for those who are lost in their grief. The support can come from friends, family, support groups, or communities. So even though somebody might not have experienced the same exact thing you're experiencing, meaning like loss from COVID, loss of a loved one, loss of your sense of normalcy, they can identify with the feeling. Experiences may vary, feelings are the same. So live normally, and normally is a loose term, normally for you, however you define normal. So after a loss, many people may lose their will to continue. Beyond removing themselves from society, they may even withdraw from activities as basic as getting out of bed in the morning. These actions might feel almost impossible when weighed down by grief. So even the act of getting up, changing our clothes, taking a shower, these things might seem impossible when we're burdened with grief. And for many people, think about when we first started lockdown. For many people, if we're working from home or maybe we don't have employment anymore because of COVID, many people said the same thing, like, well, what's the point of getting out of my pajamas? Why do I need a shower? I'm not leaving the house. And these day-to-day things are actually acts of self-love. And so when we start to neglect those things, it's going to affect how we feel emotionally. So allowing ourselves to continue to try to live normally isn't disrespectful to those we lost. Living normally isn't a sign that we're forgetting about them or leaving them behind. They will always be a part of our lives. And nobody should force themselves to do anything in which they are not comfortable. If performing daily duties is too difficult, it's fine to start small and slowly work back up to a normal level. So living healthily, so important. Again, I forget what they were calling it. I think it was like the COVID-15 or something. Everyone was talking about how because of COVID and not being able to like go to the gym or engage in exercise or healthy eating, a lot of people said that their health declined and, they put on some weight. Maybe they weren't, taking care of their bodies as well as they normally do. So disrupted sleep, loss of appetite, and a general loss of interest accompanies grief. These can all dramatically affect our health and ultimately prevent us from healing. So we can't neglect ourselves in our healing process. We have to remember that we're the most important part of the healing process. So living a healthy life might seem irrelevant or useless after a loss, but it does help many people. Exercise routines provide structure during a disorienting time. Healthy foods provide the energy needed for energy necessary to continue. And involving friends and family members with meals or exercise can provide additional motivation, alleviate feelings of loneliness or abandonment. So another thing to consider, the reason why, COVID had such an impact on, our mental health is think about the structure of your day-to-day life. If you have a job, if you have like a responsibility, like maybe like you help watch your grandkids, or maybe you have a club that you go to every day, you have, an activity you go to. When we take away that structure, now we have nothing. And that's a loss, the loss of our structure, the loss of our day-to-day. But think about how that structure keeps us healthy. It keeps us on track. It gives us a routine. And part of that routine is showering, getting out of bed, changing our clothes, brushing our teeth. We don't recognize how much structure plays a role in our ability to feel healthy. And when we take away structure, for some people, they experience anxiety because structure allows us to feel like, I know what's going to happen next, because this is how my day-to-day goes. So when we take away that structure, it might increase feelings of anxiety as well as increase feelings of depression because we feel as though we're not productive as we used to be. Finding balance. Grief and its accompanying emotions have a way of spreading through every moment of our lives. However, healthy grieving is often an active process. So finding balance between grieving and not grieving can be the difference between healing and letting grief swallow us. So gently finding moments and pockets where we don't actively grieve can help slowly move forward. This might sound a little odd, but like it is finding that balance, like the time in which we grieve as opposed to the time in which we don't grieve. So taking that time to pay respect to the emotions that we're feeling over the grief of the loss, but then also recognizing that I need to take care of myself in this process and finding that middle ground. Counseling. I may be biased, but I think everybody should be in therapy right now, especially with what's going on. So because there's no one way to grieve, it can be difficult for many people to discover the best method for them. So a trained professional, like a counselor, a social worker, a psychiatrist, a psychologist, a case manager. So these having treatment from trained professionals allows individuals to help discover their own healthy way to grieve. We process the feelings, we figure out our coping skills. Simply being able to meet with someone with whom they can talk to through their feelings is so important. Again, a counselor, a therapist, a social worker, unbiased third party. You can just kind of go and get all those feelings out and maybe figure out some ways in which you can, navigate through those feelings. Counselors can also help with other aspects of life that may become difficult since the loss. So, if we're talking about the loss of a loved one, like maybe figuring out, how do I move forward? How do I grow around my grief? Or how do I get into a new routine without this person here? Or even, processing the trauma of losing a job because COVID put somebody out of work. Counselors and therapists help with that. There's a lot of different things that counselors and therapists can help with in navigating these really difficult emotions that have come up because our world has kind of been shaken up. Unpredictable. That's like the word of the year, the past 2 years, maybe. Unpredictable, if we had to sum it up. Regardless of how we handle our grief, it is completely unpredictable for us. No matter how much time has passed since the loss, grief can swallow us suddenly like a tidal wave. All it takes is a single memory to return the pain. Ultimately, the best thing to do is not allow these moments to dictate our lives. So there's going to be things that remind us of the loss. It might be hearing a song, smelling something. It might be going somewhere. And for COVID, it might be, being in your own house. Sometimes I've had clients who say that being in my own house can be triggering because I spent so much time here and I felt so much fear as to what was going to happen. So, we can be triggered and we can be reminded of our grief in any ways in our day-to-day life. But, it's important for us to figure out what our coping skills are. So when these things do come up, we can manage them. So grief is a part of life, but it does not have to define who we are or how we live our day-to-day life. Instead, treat these moments as a sign that a loss has become a part of you and your loved one is always close. So some people may experience multiple losses during a disaster or a large-scale emergency event, such as COVID. So because of the COVID-19 pandemic, you might be unable to be with a loved one when they die or unable to mourn someone's death in person with friends and family. Other types of loss include unemployment or not making enough money, loss or reduction in support services, and other changes in your lifestyle. I know a big thing for many people was childcare, not having somebody to take care of their children, and especially first responders or essential workers, not having like a daycare center was a huge stressor for them, because how am I going to go to work if I don't have someone to take care of my kids? These losses can happen at the same time, which can complicate or prolong grief and delay a person's ability to adapt, heal, and recover. So again, with that example I just gave, somebody who might be on the front lines of COVID might say, I need to go put myself at the front lines. I might be exposed. I'm putting myself in danger. I need to find housing, not housing, I'm sorry. I need to find care for my children because I need to go to work so I can make money and take care of them. It can be very overwhelming. So just to touch on this population, adolescents are a very vulnerable population in all of this. They may experience grief in ways that are both similar and different to children and adults. So think about this age group. Adolescents may experience significant changes in their sleep patterns, isolate themselves more, frequently appear irritable or frustrated, withdraw from usual activities, or engage more frequently with technology. It's important for caregivers and parents and caregivers to engage with their adolescents over their grief to promote healthy coping and acceptance. Parents may also need to obtain mental health services for adolescents and family to deal with grief. So we think that adolescents, this generation, is very big into technology, but what we're seeing in COVID, there is such a thing as an oversaturation in technology. So think about it. They're in school all day on Zoom. They're doing their homework on Zoom. They're connecting with their friends on, whatever social media they have. Sometimes it's just too much for these adolescents, and it becomes less about connecting and it becomes less of a healthy coping skill and more of a trigger. So just something to think about. Some questions you might be asking are, should I be freaking out about COVID? And why can't I hang with my friends in person? You may be feeling worried, bored, frustrated. COVID-19 is frightening and you're not the only one feeling stressed. I think we all experience stress over it. I think we're all worried about, what's next. So back to kind of circling back a little bit to our adolescents and our teens and our children. In September 2021, they returned to school, they're back. There's mask mandates, vaccinations, and all of this was a huge debate. I'm sure a lot of you saw it on the news. People were just really uncomfortable or very pro or against these mandates. Our children hear our voices and can translate them into their own concerns and issues. So, children see things. Children are smart. They see what happens around them. They observe and they absorb. So, this was probably really triggering for many children and confusing. So while anyone can catch the virus that causes COVID-19 and people of all ages and backgrounds can get severely ill, most people have mild illness and are able to recover at home. We are very fortunate that we are living in a day and age that vaccines are so available. Like we have them here at the hospital. We have them at Walgreens and Rite Aid, and we have mobile units going out to vaccinate people. And this was a huge, huge progress for so many people. But, getting vaccinated makes such a big difference in experiencing symptoms. For those who do get vaccinated, and sometimes there will be breakthrough cases, they do experience a significant reduction in symptoms. So regardless of your personal risk, it's natural to be concerned for your friends and family about the uncertainty and changes in your daily life. Again, COVID really shook a lot of people up. It shook every aspect of our lives up. So things that you can do to manage your stress regarding the virus. Learn about COVID-19. Knowing the facts and stopping the spread and rumors about COVID-19 can help you feel more in control of what's happening. So we can help stop the spread of COVID by washing our hands often with soap and water. It's very cool. I don't know if anyone has an Apple Watch. My Apple Watch tells me how long to wash my hands for. So even our technology is helping us stop the spread. If you are sneezing, coughing, cover them, mask up. Avoid close contact with people, even your friends, socially distance. I know we think, oh, we're 2 years in, we have vaccines. We still got to play by the rules. COVID-19 may be spread by people who don't even have symptoms. So being mindful of socially distancing, wearing your mask, these things will help prevent spread of the virus as well as prevent you from getting ill. wearing your mask, do so when you leave your home to help slow the spread. And people who should not wear a mask are children under the age of 2 and anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. You can be social, but do it from a distance, such as reaching out to friends by phone, text, video chat, social media. I've noticed that a lot of people are meeting in outdoor spaces, still masked. I've noticed that, but because right now the weather is on our side, being able to utilize outdoor space has been a huge way for people to connect. So find ways to relax, take deep breaths, stretch, meditate, try to do activities you enjoy, like exercising. And it doesn't have to look at any kind of joyful movement, any kind of movement that you enjoy, do it. Gaming, reading, or other hobbies, keep a schedule, plan times for doing schoolwork, relaxing, and connecting with friends. So even though we don't have some place to be because of COVID, making sure we have a schedule and a routine. Avoid alcohol and drugs. These substances can weaken the body's ability to fight infection and increase the risk of COVID-19. So it does affect our immune system when we use alcohol and other drugs. So be mindful of that. Talk with someone you trust about your thoughts and feelings. Get vaccinated. And you may be feeling lost or distressed over the changes in your life during this time, but there are steps you can take to cope with your grief. So grieving the loss of a loved one while coping with the fear and anxiety related to the COVID-19 pandemic can be especially overwhelming. Social distancing, stay-at-time orders, and limits on the size of in-person gatherings have changed the way friends and families can gather and grieve, including holding traditional funeral services, regardless of whether or not the person's death was due to COVID-19. So regardless of the patient's, cause of death, we notice that we're not able to grieve the loss or say goodbye in the way we used to. However, these types of prevention strategies are important and help slow the spread of COVID-19. So some things you can do to help cope with the feelings of grief after the loss of the loved one is connecting with other people, however you can safely do so. Creating memories or rituals, I always like to call that continuing the relationship, however you find that, and asking for help from others, letting somebody know if you're having a hard time. So during the COVID-19 pandemic, the family and close friends of a person who died from COVID-19 may experience stigma such as social avoidance or rejection. Working in a hospital setting, I'm sure, everybody can kind of attest to this, having COVID or being around someone with COVID made you kind of like a pariah, like people didn't want to be around you. People thought you were going to give them the virus. Like I remember even at one point I was wearing scrubs coming into the hospital, and I would go to the supermarket after, work just to go grab something. And I had my mask on. Of course, I'm being safe, but people saw me in scrubs and they avoided me because they didn't know who I was, where I was working, who I was around. It really made people nervous. I mean, I'm in a behavioral health setting, so I wasn't seeing patients, but people looked at me like I was, bringing it right into their front door. Stigma hurts everybody by creating fear or anger towards other people. And some people may avoid contacting you, your family members and friends, when they would normally reach out to you. So we see the stigma of the virus. Stigma related to COVID-19 is less likely to occur when people know the facts and share them with extended family and friends and others in your community. So stressors impacting mental health, specifically with COVID. Fear of the virus and the unknown. Again, this ever-changing landscape we're living in every day. Fear of the vaccine, pressure to or not to vaccinate. This is still a hot topic. Social isolation, increased use of technology. For some people or some mental health patients, we have noticed an increase in paranoid symptoms. The frequency or the increase in technology can be triggering for them. Increase of substance use to cope with increased fears. Distancing from family and friends, our loss of support system, even like going into work every day. Think about how when you go into work every day, what that does for you, that social component. Grief and loss related to the death of a loved one, so inability to be with family members related to the COVID diagnosis and medical issues leading to loss of life, loss of employment, fear of seeking care and support, staying home too long, and financial stressors. So this we actually saw a lot at the hospital. So here at Bergen-Newbridge, we are primarily a behavioral health hospital. We are a full-blown medical center, but we have over 300 mental health beds. What we did see happen during the pandemic is that there was a lot of fear of going to the ER for help. So patients who might have gone to the ER earlier did not go because they were afraid of getting sick, they were afraid of the virus. So people might have much more severe symptoms when they finally did seek help. And that was a challenge that we experienced. So Grief and loss, just some common things you might experience. It's important to remember, again, that everyone deals differently with these feelings, but some common reactions you might experience are shock, denial, anxiety, distress, anger, periods of sadness, loss of sleep, loss of appetite, and lethargy. Just because I work specifically with a suicide prevention grant that was, it's a federal grant we have here at the hospital called Suicide Prevention and Response. So this grant specifically focuses on clients who have had a recent suicidal ideation or suicide attempt, and it is specifically made for the COVID-19 pandemic because of the impact it had on mental health. So just some things for everyone to be aware of in regards to mental health. These might be some risk factors that are present when someone is experiencing suicidal ideation, or could be a risk for suicide. So history of substance abuse, physical disability or illness, losing a family or friend to suicide, ongoing exposure to bullying behavior. Again, we're around our computers and we see some, keyboard vigilantes. Mental health condition, maybe a previous diagnosis, recent death of a family member or close friend, again, not being able to say goodbye, especially in COVID, access to harmful means, relationship problems, that could include isolation or previous suicide attempts. So these are just some things to be aware of, especially if you notice anything in your friends or family, let them know you're there to talk, be present for them. And COVID-19 and older adults. So again, are important and vulnerable population. The geriatric population has been the most widely noted, as among the highest risk. So due to the increased vulnerability in this population, it is especially important for them to practice social distancing. And it's important for those who are, even not in this age population, to practice social distancing, especially if they're caregivers for this population. So what makes older adults vulnerable to psychiatric decompensation during COVID? So many people in the geriatric population may not have access to social media. Community events that drew seniors and the elderly out of their regular spheres are no longer happening. And the lack of visitation with loved ones, including in healthcare settings. So this actually did happen in our long-term care unit. We couldn't have visitation because of COVID. We are finally getting back to a somewhat normal schedule, but this is something that impacts this population because visitation was such a big part of their day and it gave them a lot of joy. So how can we support our older adults? It's important to communicate with them that it's okay to express these difficult feelings. Talk about it. It's okay. Call them often and ask them about any depression or anxiety symptoms. Create visitation opportunities via technology. Also, we see this image, you see the grandparents visiting their grandkids through the glass. We figure out a way to make it work. We keep it safe, but we make it work. And opportunity for vaccination. So another huge component in grief and loss is resilience. So psychologists define resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family and relationship problems, serious health problems, or workplace and financial stressors. So some way that we can improve our resilience is physical fitness, taking care of our bodies, exercise regularly, get quality sleep, eat healthy, and avoid mood-altering drugs, the overuse of alcohol, and use healthy risk dangerous behaviors. So that could look like, being outside and making sure that you're safe socially distancing, making sure that you're taking care of yourself and, doing things that engage your mind. Interpersonal fitness, so reconnect with social supports virtually or socially distance if you can. Lean on others and seek and accept help. Give back and help others. Participate in social networking. Share emotions with someone you trust. Use community resources. Use cultural or ethnic traditions and identity as a support aid. Find a model or a mentor, a role model or a mentor, or use pet to maintain and develop relationships. Adopt. Pets are so therapeutic. There is something so healthy about that unconditional love. Emotional fitness, so cultivate positive emotions. That can be through your hobbies, that can be through any kind of creative arts, journaling, whatever that may be. Create a bucket list of emotionally uplifting activities and do them. However small it may be, like doing a face mask for myself. Sure, that's on your bucket list, do it. Develop long-term and short-term goals and start your journey. Use positive humor and express gratitude. I had somebody who had a gratitude jar. I really love this. They had a jar and every day they wrote one thing that they were grateful for in that day. At the end of the day, they'd write down I'm grateful for nice weather, and they would put in that jar. And, at the end of when the jar was full, they took everything out and they read every single thing they were grateful for. And it really did help improve their mood. So behavioral fitness, develops a safe, a regular routine. Again, routine is something that is so healthy and important for us. And stay calm under pressure, keep your cool. Prepare for high-risk situations and break tasks into doable subtasks. Take a news holiday, turn off the TV. It is okay. You're gonna get the information, but sometimes we need like a 10-minute breather. Establish a new normal routine. Read to find comfort. Avoid making things worse. Rekindle hope and use positive religious or spiritual ways of coping. And this is just a little slide about growing around grief. So here's the new way of thinking about grief recovery. So we see that we have this one dark little sphere, and that represents a life that is totally consumed by grief. So this theory suggests that over time, your grief will stay the same, but your life will begin to grow around it. You will have new experiences, meet new people, and begin to find moments of enjoyment. Grief doesn't always disappear with time. It also shows that despite grief not going away, this doesn't mean you will always feel as bad as you do right now, because your life will grow around the grief. So I just like this little way of thinking about it. It doesn't mean that we're negating the grief or we're not feeling it. We're just incorporating it into our lives. So complicated grief is something that does happen for some people. It is an ongoing heightened sense of mourning that keeps you from healing. Signs and symptoms of complicated grief may include intense sorrow, pain and rumination over the loss of your loved one, and focus on little else but your loved one's death. So it does interfere. This complicated grief would be something that interferes with your day-to-day. Some individuals experience feelings of grief that do not appear to ease with times, and in some cases, the symptoms may even worsen. So the medical community does refer to this as complicated grief. It is understood. Many people with complicated grief feel extreme guilt and wish they had passed along with their loved one. They experience deep sadness and depression and may completely isolate themselves for months and years following the loss. And treating complicated grief is similar to learning to manage normal grief, but it may require additional support from friends and family. So additional professional care may also be beneficial for some people who are experiencing complicated grief. They may have to take medication, they may have to go to counseling, which is always, options, but they do experience it on a deeper level. And just something like, again, somatically, we have to think about grief. Grief increases inflammation, which can worsen health problems, and problems that you already have and cause new ones. So it batters the immune system, leaving you depleted and vulnerable to infection and the heartbreak of grief. Can also increase blood pressure and risk of blood clots. So something to think about. And your brain is on overload with thoughts of grief, sadness, loneliness, and many other feelings. Grief brain affects your memory, concentration, and cognition. Your brain is focused on the feelings and symptoms of grief, which can leave little room for your everyday task, and recognizes it as steps towards healing. So we will experience physical symptoms of grief as well. So it's important to be kind of mindful of these things and look out for them. So any questions for me? I know it's a lot of information.
That was wonderful. Thank you so much for such a comprehensive, program. Mm-hmm. So much information, like you said, great information. I was thinking about just the different ways that grief presents itself, right? And I think that's the trickiest part. It's not always linear. It's not always real clear. It's not always about someone crying or feeling a loss. It can be irritability. It can be road rage or being in a store and walk rage, or right. I think we see a great deal of that, in particular at Valley, at the hospital. I was mentioning early too that what we're finding is I think people are struggling and they don't know quite what to do with that struggle. A lot of impatience, being sick of things, COVID in general. Mm-hmm. See it on the airlines. We see all these, in the media about, people really struggling on, as they travel. So I really truly believe, a lot of this is associated with so much loss and change, mm-hmm. and grief. So thank you for all this information.